After 70, the greatest danger to your health isn't always disease. Sometimes it's the medical test that finds one. Every day, I meet older adults who feel wonderful, eat well, stay active, yet are told they must undergo a series of routine medical screenings, colon exams, prostate tests, heart stress checks, because they're considered mandatory after a certain birthday. But the truth is, research is beginning to show that some of these screenings may bring more risk than reassurance for healthy seniors. Understanding which tests truly protect you and which ones can quietly create harm can spare you unnecessary procedures, stress, and complications that steal the very years we're trying to preserve. Welcome to Life After 65. I'm Dr. Eli Morgan. Together we explore how to stay strong, sharp, and deeply alive, not by chasing every test or treatment, but by making wiser, evidence-based choices for the years ahead. The hidden problem in modern medicine. It's an uncomfortable truth in modern healthcare. Even the most well-intentioned system can fall into routines that no longer serve the people it's meant to protect. Many screening tests became standard decades ago, when our understanding of aging, risk, and longevity was different. Yet they persist today, partly because they generate revenue and partly because it feels safer on paper to do more. But more isn't always better, especially as our bodies and priorities change with time. So if these tests aren't always helping, the question becomes, why are we still being told they're essential? Let's look honestly at what the science says and why informed restraint may sometimes be the most protective form of care. Why this matters to you. Whether you're approaching your 70s, already there, or helping care for someone you love, this conversation touches all of us. We spend decades learning to take charge of our health, checking numbers, following advice, staying proactive. But at a certain point, the question shifts from how much can we do to what truly helps me live well from here. When we understand which medical tests still add value and which may quietly chip away at our strength or peace of mind, we protect not just our lifespan, but our life experience. And that's what truly matters, living with clarity, freedom, and confidence in our choices. Because sometimes the most powerful act of self-care is knowing when to say, that test might not be for me. The familiar scenario. You might recognize this conversation. A 73-year-old patient sits across from me, smiling. "Doctor," she says, "I feel great. I walk every morning. I eat well, no symptoms. But my doctor says I must have another colonoscopy, a heart stress test, and my husband needs another prostate screen. I'm confused. If we're healthy, why test?" It's a fair question, and one I hear often. Deep down, many older adults sense the imbalance, that a body feeling strong and steady shouldn't automatically be treated as a ticking clock. These tests were designed to catch disease early, but in healthy seniors they can sometimes uncover problems that would never have become harmful, leading to unnecessary procedures and stress. Stay with me, because by the end of this talk, you'll have the clarity to decide which screenings truly protect your health, and which ones might quietly take it away. The medical reality shift after 70. Medicine doesn't stand still, and neither do our bodies. What makes sense for a 50-year-old doesn't always serve a 75-year-old with different rhythms of healing, metabolism, and recovery. Screening tests are built on a simple formula. The benefits must outweigh the risks. But after 70, that balance shifts. Many conditions that once seemed urgent grow so slowly they'll never threaten life expectancy, while the procedures used to find them can cause real complications, from dehydration to bleeding, even hospitalization. That's not fear talking, it's physiology. At this stage of life, resilience and recovery look different. The goal isn't to do less care, it's to do the right kind of care. Because when testing no longer improves health or comfort, the bravest medical choice is often to pause, ask questions, and proceed with wisdom instead of reflex. preview of the 3 tests. So which screenings are we really talking about? 3 in particular appear again and again on the medical to-do list for people over 70, often labeled as routine or mandatory. The first is the colonoscopy, still promoted long after its benefits begin to fade. The second is the prostate-specific antigen, or PSA test, which can uncover slow-growing cancers that rarely cause harm. And the third is the cardiac stress test, a procedure meant to reveal hidden heart disease, but often creating more worry than wellness. Let's look at each one closely and see what current science and decades of patient experience really tell us. Test number 1, colonoscopy. Let's begin with the colonoscopy, perhaps the most debated test in older adults. For many years, it was considered a life-saving routine, and for good reason. Finding and removing early polyps truly reduced colon cancer deaths in middle-aged adults. But by the time most people reach their mid-70s, the story changes. Research now shows that for seniors who've had normal results in the past, repeating the procedure rarely extends life. What does rise, however, is the risk of complications. Dehydration from bowel prep, heart strain from sedation, and in some cases, tears or bleeding in the colon that require emergency care. If your last colonoscopy was clear and you feel well, the chance of a new dangerous growth developing before age 85 is extremely small. The cancer grows slowly. Your body, in contrast, has already won decades of health. Now, if you have new symptoms, bleeding, pain, or sudden weight loss, that's different. Then the test becomes diagnostic, not routine, and it can be valuable. The key is context. After 70, the question isn't, should I get screened? It's, does this test still serve my health today? Test number 2, PSA prostate screening. Now let's talk about the PSA test, the blood screening used to detect prostate cancer. For men over 70, this one can be especially tricky. PSA levels naturally rise with age, even in men who are perfectly healthy. An elevated number often sets off a chain reaction: biopsy, treatment, side effects, and months of anxiety, all for cancers that may never have caused trouble in the first place. Autopsy studies have shown that most older men have some prostate cancer cells that remain completely harmless for life. The danger isn't in having those slow-growing cells. It's in reacting to them too aggressively. That's why most major medical organizations now recommend against routine PSA screening after 70, unless there are specific symptoms or a strong family history. It's important to remember that a high PSA isn't a verdict. It's a conversation starter. And sometimes the wisest path forward is watchful patience, regular check-ins, and a focus on living well rather than chasing numbers. Because the goal at this age isn't to eliminate every possible threat. It's to protect the quality of the years still unfolding. Test number 3, cardiac stress testing. The third test is the cardiac stress test, often recommended just to check your heart. On paper, it sounds sensible. Find hidden heart disease before it causes trouble. In practice, though, the reality is far more complicated. For healthy, symptom-free seniors, this test can actually trigger the very problems that it's meant to prevent. By pushing the heart to its limit, stress testing can cause strain or rhythm disturbances, especially in people who already have mild heart disease. Even more common are false positives, results that look abnormal but aren't. That single line on a printout can send you into a cascade of further testing. Catheterizations, stents, and lifelong medications, all because of a test that was never truly necessary. One large study found that older adults who underwent stress testing without symptoms had no better outcomes than those who skipped it, yet experienced far more complications from the follow-up procedures it triggered. The takeaway? If you have chest pain, breathlessness, or unusual fatigue, by all means, get evaluated. But if you feel well, A stress test may not reveal strength. It may test it. After all, longevity isn't just about finding problems early. It's about living wisely, calmly, and fully in the years we have. A few years ago, I met a woman named Margaret. She was 76, full of life, still gardening, traveling, laughing easily. Her previous doctor had lined up 3 routine procedures: a colonoscopy, a PSA test for her husband, and a cardiac stress test for both of them. They were told it was all standard preventive care, but something didn't sit right. They both felt fine. So we sat down together, reviewed the latest data, and weighed the real benefits against the risks. In the end, they decided to skip the tests and focus instead on daily walks, balanced meals, strength training, and keeping their blood pressure steady. 5 years later, Margaret sent me a holiday card, still active, still healthy. She'd lost friends who went through unnecessary procedures and never quite recovered. Her note said simply, "We chose peace over panic. Best decision we ever made." Scientific validation recap. Margaret's story isn't unusual, and it's strongly supported by research. Several large medical reviews, including those published in major journals like JAMA Internal Medicine, have compared seniors over 75 who continued aggressive screening with those who stopped after normal results. The findings were remarkably consistent. No difference in lifespan, but far higher rates of complications among those who kept testing. Campaigns such as Choosing Wisely, led by respected medical organizations worldwide, now caution doctors to limit these routine screenings in healthy older adults. Their reasoning is simple. When a test is more likely to cause harm than to improve health, restraint becomes the smarter form of medicine. The science is clear. Thoughtful selectivity, not endless screening, is what protects well-being after 70. Questions to ask your doctor. So how do you turn this knowledge into action? It starts with better questions. Calm, respectful, but direct. Ask your doctor. Given my age and overall health, what's the actual chance this test will change my outcome? What are the specific risks? Not just of the test, but of the treatments it might lead to. If we find something small, will we truly treat it? Or only worry about it? What do current medical guidelines say for people my age? These questions don't challenge your doctor. They invite partnership. Good physicians appreciate patients who want clarity, not confrontation. When you ask wisely, you remind your care team that your goal isn't just to live long, it's to live well. Because the most powerful prescription you can ever fill is understanding. Positive health focus. Instead of overtesting. After 70, health isn't measured by how many tests you complete. It's reflected in how you move, rest, connect, and nourish your days. Focus your care on what truly extends life and joy. Steady movement, strong muscles, balanced meals, and meaningful friendships. Keep an eye on the conditions you already know: blood pressure, sleep, bone health. And let go of the reflex to search endlessly for new problems. When you honor the body's natural wisdom, you create space for calm strength to return. Sometimes, less medical noise brings more real vitality. Healthy aging is not about resisting time, and it's about cooperating with it gracefully. And that kind of peace often adds more good years than any test can promise. Bridge to supportive wellness advice. If you've decided to be more selective about medical testing, that's a powerful first step. The next is nurturing the strength that makes those choices possible. Our bodies, even in later years, respond beautifully to care, to movement, hydration, balanced nutrition, and calm sleep. Supporting these systems helps you stay independent, clear-minded, and confident in the decision to avoid unnecessary interventions. So, as we shift from screening to strengthening, let's talk about gentle, natural ways to keep your heart, energy, and immune system working at their best. Support options or educational resources. There's no single supplement or shortcut that replaces smart living. but a few natural supports can help keep your foundation strong. Nutrients such as L-citrulline, found in watermelon, may gently support blood flow and heart function. Others, like fenugreek, nettle root, or tonkadali, have been studied for their role in maintaining vitality, metabolism, and hormone balance as we age. Think of these not as replacements for medical care, but as companions to a healthy lifestyle, ways to keep your circulation, energy, and mood in balance so your body functions smoothly. If you're considering any supplement, review it with your healthcare provider to ensure it fits your specific needs. The goal is harmony, not overhauling what's already working. Supporting your health naturally allows your medical care to focus where it matters most, on helping you thrive, not just survive. Closing message. At this stage of life, wisdom is our greatest medicine. We've lived enough years to know that more isn't always better, and that sometimes real courage means choosing calm over urgency. When you say no to unnecessary testing, you're not refusing care. You're choosing a gentler, smarter kind of care, one that values comfort, awareness, and the strength you've earned. Keep nurturing your body through movement, purpose, and connection. Keep asking questions that honor your life experience. And most of all, keep trusting that health after 65 isn't about fighting time. It's about living deeply within it. You deserve care that respects both your years and your wisdom. I'm Dr. Eli Morgan, and this is Life After 65, where we keep learning how to stay strong, sharp, and fully alive. Thank you for being here and for choosing your health with clarity and kindness.